Hello and welcome to the SmartXR launch event. We're coming to you live from the Agfa headquarters in Belgium. My name's John Gibbs and I'll be your host for this event. Today we're launching a brand new exciting DR solution, and of course we wish we could have been together with you at the RSNA to present it face to face, but we all know why that's not happening this year. We hope you're all staying safe and feeling well. And if you're in some form of lockdown, well, we know how that feels as well. But we do love a captive audience, so that's certainly a positive. Now, during the session, we will have a lot of help from a lovely assistant. Her name is Liv. Say hello, Liv.
Hi, I am Liv. The people at Agfa have more than 120 years of experience in the radiology field, and they have channeled that all into me. I can use that know-how to offer you workflow assistance and turn working with our equipment into a breeze. X-rays are the single most performed imaging diagnostic. Did you know more than 2 million radiographies are being carried out on our equipment each day? With such a busy workload, everyone could use a helping hand, wherever you are.
Well, thank you, Liv, and we'll be seeing more of Liv a bit later on in the program. But what else do we have lined up for you today? We'll be talking to Professor De May of the University Hospital of Brussels. He'll be talking about the expectations and challenges for radiology today. We'll also be talking to some customers from the United Kingdom and from Germany. And at the end of the program, we'll have a Q&A session, and you'll be able to submit your questions to our panel. And you can start doing that now if you like. If you look down below the video that you're watching, there'll be a little chat box and you can type in your questions. You may have to scroll down to see it. And that's, of course, only if you're watching this live broadcast. All your questions will be answered by our panel of specialists, which are Gert Merks, who is our Global Product Manager. Hi, Gert.
Hi, John. Thanks for having us.
We have Jeroen Kant, who is our Research Team Lead. Hi, Jeroen.
Hi, John. Great to be here.
And we have George Espada, who's not in the studio with us. He's through a video link, and George is the Radiography Solutions Business Group Leader. Hi, George.
Hi, George. Hi, John.
Good. You see, it's going to be just like RSNA, but a bit different. Yeah. Now, to kick it off, let's hear a message from George Espada.
Thank you for tuning in our exciting unveiling moment. RSNA is an iconic event. We look forward meeting our customers, discuss evolving and new needs that help us co-create new solutions. It's also a fundamental moment to showcase our innovation. Last year, we introduced the DR100S, a new concept in mobile imaging, onboarding artificial intelligence and machine learning to take X-ray to the next level. Today, we deliver on our innovation promise and on our vision, which is to transform radiology, bringing intelligent and definitive answers to patients. A warm welcome to our new family member of the DR portfolio. I see you as a new assistant that contributes in elevating the performance of X-ray.
Thank you, George. I'm also very excited to start on this new journey to all these different countries. I know I might look like a rookie, but being supercharged with Agfa's imaging experience just makes me want to put it to use. And my creators are working so hard to make me grow even more. I really look forward to supporting the routine of radiographers and radiology services throughout the globe.
Having met myself many customers around the world, I can clearly see the value that you bring. Now, to help us know you better, how would you define yourself?
Well, I am Liv, Agfa's radiography workflow assistant embedded in all SmartXR-enabled systems. My unique mix of hardware and AI-powered software helps radiographers in their day-to-day imaging workflow. That way we can boost productivity and prevent some common mistakes from happening in the first place. I hope that my support can bring our users some relief in these stressful times.
Okay, so does that mean that you can already be used on the current DR portfolio?
Indeed. I'm going to be available to support the users of DR600 and DR100s Agfa's launch from last year that already envisioned my arrival this year.
Great. I know that you've been already around supporting some of our customers that have tested your skills, so how about listening to them?
Yes, I already had a nice time with a couple of humans. Let's see if they feel the same way.
Well, Liv, we will certainly do that, but that'll be just a little bit later. First, I have a question for George. Hi, George. George, can you tell us how this launch fits into the radiology solution strategy?
Thanks, John. And before I answer the question, obviously a warm welcome from my side as well to all the viewers, wherever you are, hopefully safe. It's a pleasure to have you. And let me just articulate that particular answer. In Agfa, our radiography solutions group is really in a goal to, as in a vision, to transform radiology by bringing intelligent and definitive answers to patients. In order to realize that vision, our strategy really builds focus on three pillars. One around efficiency, ability to make X-ray a much more efficient modality and a much more efficient experience. Improving ultimately workflows and transforming workflows in many ways. AI will be a certain component into this. And obviously all of that as well to the benefit ultimately of our patients and of our radiographers. Ultimately, radiology also evolves towards expanding access of radiography and expanding as well the clinical relevance of radiography. And those are two aspects as well that we aim a little bit later in our focus, in our strategy, to ensure that X-ray elevates its contribution to the overall patient pathways.
Okay, thank you, George. Now, to find out what the challenges are in today's radiography, let's take a look at a video that we recorded earlier when I spoke to Professor Demey of the University Hospital in Brussels. Hello, Professor Demey. Thank you for taking time out of your busy schedule to talk to us today. What do you see as the main radiography challenges today?
Thank you for the question. In my opinion, there are some big challenges in radiology. First of all, I would like to say that radiology is not dead. CT and MRI is doing a good job, but now with the COVID crisis, we've seen that the importance of radiology is still there in the clinical work, on ER, and also on intensive care. And the biggest challenges for me at the moment is to come to good, standardized, consistent images. We have not enough well-trained people in all hospitals and also during the night to go for those nice, consistent, high-quality images. So in my opinion, we need something which is helping us to go for nice, but mainly for good scientific imaging in all places in the hospital.
How do you think technology like SmartXR can make a difference in countering those challenges?
If you have less trained people, technology can help them how to go for good positioning, how to avoid retakes, how to be sure that the image is really consistent with a good dose. And technology like SmartXR can bring the solution there. And in my opinion, in the future, we will go for more AI and more comparison of images, certainly on intensive care. And at that moment, a good consistent images makes it possible to think about that future and to go for real science. Imaging is an art, but I think the part of science has to come with it, and those new technologies can help us there in a perfect way.
Professor Demey, thank you very much for your thoughts on those interesting challenges that we face. Now, Geert Merks, the SmartXR Global Product Marketing Manager, is in the studio with us today, but he also recorded a video where he explains how SmartXR will counter those challenges that we face.
With SmartXR, we make our systems aware of their environment. A SmartXR upgrade allows them to transform from a tool to operate to an agent that works with you. Liv, our avatar, is the embodiment of that. Her goal is to make everyone's life a bit easier, whether you're acquiring X-rays or reading them. For radiographers, SmartXR brings ease of use, guidance, and a helping hand. For radiologists, it brings more consistent images. In doing so, we want to offer the tools to do more with less, because even before the pandemic, that was the main thing on our customers' minds. Now, let's have a closer look at the features we bring to the table. In this first generation, we are introducing 4 major features into our portfolio. Let's start with smart positioning. With more than 120 years of radiography experience, we at Agfa carry X-ray imaging in our company DNA. While many see plain X-ray as a commodity, we see it as both an art and a science. The actual acquisition process of the X-ray image is quite complex, with much more degrees of freedom than a CT or an MRI scan. However, with less and less focus on radiography in training, an ever-rising pressure on healthcare budgets, and the complexity of radiographic positioning, we are fully aware that our customers could use a helping hand. So, to have consistent radiographic output and to prevent positioning mistakes that could lead to a retake, we gave our systems eyes. And we gave Liv a sense of vision. Let's see what she can do with that.
Come on in, and we will have a quick look at your chest. An important productivity feature I offer is smart positioning. Before the X-ray is taken, I create a live, augmented view of how well the patient is positioned. I show the location of the exposure detection cells and the boundaries of the X-ray image using handy overlays. This assists you to position the patient more accurately, which speeds up the process significantly. Smart positioning also prevents the need for retakes and enables you to remotely position from the control room. So we will be ready in no time for the next patient.
So aside from a live view on the patient from the system's perspective, smart positioning can show you things you cannot see with the naked eye. One of the elements we add in the augmented reality image is the location of the exposure detection cells. This helps to check quickly if no lead shielding is blocking the AEC, which avoids a retake due to overexposure. In contrast, an active cell not covered at all by the patient will lead to a retake due to underexposure. There again, smart positioning will notify you if it's not covered and it will urge you to disable it. The collimation area we overlay on the patient makes shooting consistently positioned images easier. And checking for patient movement can be done at the patient's side, but also remotely, right before the exposure. After all, having to repeat exams is time-consuming, it creates frustration and additional dose for the patient. Another SmartXR feature is Smart Rotate. For this, we gave Liv a deep learning neural net. She uses it to interpret the contents of the radiograph, to determine the upside of the image. The image will then be presented in a consistent orientation, both on the modality and on the PACS.
My neural net also takes a look at the image content to rotate the incoming images to the correct orientation, resulting in consistent images that are presented correctly the first time without the need for post-processing.
No more need to check the detector's orientation and no more need to hit the rotate button for the majority of out-of-Bucky exams, as Smart Rotate supports hands, feet, thorax and abdomen exams. We also gave Liv a sense of balance. This is used by Smart Align to avoid projections with inconsistent angulation. When a projection becomes too oblique, X-rays get caught in the anti-scatter grid. The more off-center you are, the higher the chance a retake will be needed. This was already available as a separate feature with the introduction of our mobile X-ray unit, the DR100S, last year, but is now also available for our DR600, our ceiling-mounted DR room. Let's see how it works there.
To efficiently make consistent and accurate projections, my Smart Align sensors show you when the tube and detector are well aligned. And the angle indicator turned green. We're there.
No, we're not completely there yet, Liv. In giving Liv vision, we did not just give her regular vision. We gave her 3D vision. SmartDose uses this to scan the thickness of the body part in the collimation area. Some of you who were trained on using Agfa film might remember. To have the exposure settings just right for the patient, radiographers measured the thickness using calipers. With digital imaging, this is no longer needed. but incorrect exposure parameters are still responsible for 1 out of 6 retakes. Having SmartXR suggest suitable exposure parameters helps you to achieve consistent and first-time right imaging with a dose tailored to the patient. On top of that, it's faster than having to estimate and set the exposure parameters yourself. Let's have a look at a procedure assisted by SmartDose.
We are ready to take the abdominal exposure. But first I will recommend a dose adjustment tailored to this specific patient. With my 3D Smart Dose sensors, I can size up the patient and recommend optimal exposure parameters. This is faster than manually adapting them. And in doing so, Smart Dose lets you avoid retakes caused by over or underexposure. Plus it helps you to maintain a consistent image density.
I hope this illustrates how we smarten up our imaging systems. With Smart Positioning, Smart Rotate, Smart Align and Smart Dose, SmartXR can offer you a helping hand to efficiently produce consistent radiographic images.
Well, thank you, Geert. Now is probably a good time to remind everyone that you can submit your questions into the chat box under the video, and we'll be looking at them later. But for now, I have a few questions to the two guys in the studio here. My first question to you, Jeroen. What did it take to bring this intelligence to X-ray equipment?
Well, good question. First of all, we went back to our customers and we listened and tried to identify what the real challenges and problems are that they still face in their X-ray imaging workflow. And once we identified these challenges, we realized that we had to add a lot of sensors to our system in order to help them, for example, with patient positioning. And not only sensors, but also we also added a camera, and we even added a depth camera to measure body part thicknesses. And afterwards, after we had these sensors, our research team in the lab developed new algorithms together with our customers to make sure that we can handle these problems. And then finally, when it worked in the lab, we spent quite some time actually productizing these algorithms, because it still takes some effort to make them work in real life, in real hospitals, on our machines.
Mm-hmm. Of course. Okay. Thank you. Thank you. Geert, a question for you. One of the goals of SmartXR is to reduce retakes, but are retakes really such a problem?
Well, the size of the retake problem depends a bit on where you are in the world. So there's regions where it's very well under control, like regions where it's monitored. Take, for instance, the UK, where the NHS monitors the retake rate. In other regions, there is less monitoring, and you automatically see a higher retake rate there. We see that in our own data, and also academic data confirms this. And you quite frequently see retake rates of up above 20%. So that means that there's huge potential to increase efficiency by tackling the retake problem. And it also shows potential to reduce dose by that same percentage, because obviously each retake is additional dose for the patient. And of course, that's what we want to avoid.
Of course, very important. Okay, thank you, Geert. Now, let's find out what some of our users think of the help that they've been getting from Liv. We've put some questions to Jennifer Harrison, a senior radiographer, and Brittany Burgess, reporting radiographer at the City Hospitals in Sunderland in the United Kingdom.
It's fine-tuned some of our examinations. So when we do, for example, a chest X-ray where we position the patient and then we leave to turn behind the screen, and we can't see the patient too clearly because of the X-ray tube, we can still see them via the camera. So when we ask them to take the breath in, and if we see they raise their shoulders too high, we can correct that before we expose, saving the patient a dose of radiation. It helps fine-tune the examination. So if we have a patient, for example, for a KUB, and we've positioned not quite bang on, when we go behind the screen, we can see the AECs and we can see that it's not in the correct place. Again, we can change it again before the exposure is made, saving more radiation again. I think it will help newly qualified radiographers and junior members of staff for when they go and do an exposure, if it identifies the density of the patient, and it'll highlight whether they need to increase or decrease their exposure values accordingly, which would otherwise possibly end up in a suboptimal image quality.
Well, thank you very much for that feedback from City Hospital Sunderland. Now, we also spoke to Professor Dr. Thomas Lehnert, Chefarzt of the RSN Gemeinschaftspraxis Radiology in Wiesbaden, and they have been using our DR600 system upgraded with the new software.
Well, to apply the correct dose with the correct exposure parameter is extremely important for the quality of the provided images, in particular for all exams in the German, Swiss and Austrian region. As we all know, different exposure techniques have severe impact to the image impression for the radiologists and may lead to slightly different diagnosis. And getting automatically the correct and for the patient sufficient exposure parameters provide a high stability of image impression to the radiologist. So this is a saving of time for both, for the radiographer and the radiologist. While in countries like Austria or Germany, part of the image aesthetics and also part of the frequent judging of radiological authorities is the correct positioning of the X-ray object as it should be. A radiographer have to spend additional time on a workstation to adjust the image after the image acquisition to get the object into the requested orientation. And to get this automatically will save time in this automatic mode where radiographers can better focus on the patient. Having a patient positioning under control is a difficult item, I think. And in particular, when you have a trauma, an elderly or a mentally confused patient. Already on the way between the patient and the control room, a patient could have moved, and if not immediately seen, it could impact the image quality, dose, or even the correct position of the object. And having the ability to control on an easy way patient and his movements on displays on both on the overhead tube crane and on the workstation display is giving a better patient control, which finally results in better images, avoiding retakes due to patients' movements. And all these features helping to reduce patients' dose, retakes, and improving the workflow, and it is more than welcome in a radiological environment.
Well, many thanks to our customers for providing their insights into the new features. Right now, it's time for our Q&A session, so let's have a look. We've had a few questions coming in. A good one to start off with for Jeroen. Jeroen, what happens if the software goes wrong?
So, it's a good question, first of all. The thing is, our system is designed as an intelligent assistant. So it means the operator remains in full control the whole time. And our system is designed to give suggestions on, for example, patient dose, give suggestions on positioning, etc. The operator can always override these suggestions. He can still do whatever he feels is necessary, but at least our systems are designed in such a way that you get good suggestions to improve your workflow.
Okay, thank you. Important that the operator remains in control. That's the
yes, it's something we thought of very deeply as well with our customers.
Okay, thank you. Okay, this one for Gert. Gert, which geographies and countries is the SmartXR solution available or will be available?
So our first installs are in Western Europe and the US. So these are the two key markets we're focusing on right now. But obviously we want to expand because the problems we're addressing are very much global problems. And that's where we want to be there for our customers.
Okay, thank you. Maybe let's have a question for George. There's one here. George, what are Agfa's priorities in the domain of artificial intelligence?
Thanks, John, for the question. I think the priorities are very much aligned with our strategy. The first priority is certainly building efficiency. It's paramount that we quickly make X-ray a more efficient and, in a way, a more reliable modality. The other element, I think, is to improve the experience of X-ray. I think this is valid for both the patient and the radiographers, and make it a much more faster, dose-sensitive and reliable outcome. Those are, for us, the first two pillars, but obviously opening up afterwards, and AI is certainly the right axiom for this, elements of accessibility, particularly outside of the traditional radiography spaces, and also thinking of increasing reach in clinical relevance, where there's a wealth of opportunities where AI can contribute on this aspect.
Okay, thank you very much, George. Let's go back to Geert. Question for you. Is SmartAlign only on the 600, DR600?
So indeed, we support SmartAlign on the DR600, but we also support it on our mobile system. That's the DR100S. And there, of course, it's I think the use case there is much stronger, especially given the COVID pandemic with all this bedside imaging. And the alignment problem is also very important in that setting. So it's supported both on the DR600 and the DR100S, to summarize.
Not on the older DXD systems?
On the older DXD systems, they unfortunately cannot enjoy these benefits.
Understandable. Yeah, okay, thank you. Where are we? This is probably for you as well, Geert. Is it just a software upgrade or hardware too?
So it's a combination of software and hardware.
Okay. Yeah, it's short. It's short. Yeah. Good. Back to George, maybe. George, will there be more than 4 features in the future?
Absolutely, John. I think, obviously, as you can imagine, this is the beginning of the journey in putting in practice what the potential of AI is. We are at the beginning of the journey. I think it's the first milestones, but we can envision already now some very compelling opportunities in the efficiency, again, to repeat myself a bit in the strategy topics, but we have to make X-ray more efficient, which is a better outcome at lower cost overall. We can make effectively, after that, X-ray a more effective experience, a preferable experience. Because we're talking about patients, we're talking about radiographers, we're talking about those, we're talking about time. There's a wealth of opportunities in the area of workflow, and I think the future lies in the modality, in making that workflow improve directly at the modality where things happen with patients. And ultimately, I think we will see more happening in the area of facilitating X-ray to move outside of that very protected and, in a way, very regulated environment in the hospital, and see where that accessibility can take us to look at new forms of touching patients earlier, more efficiently as well, and also increasing the relevance of X-ray in terms of clinical areas. We today are very focused around the bone and the lung, but I think there's opportunities for this modality to also step up and contribute more generally to the pathway of patients. So if you allow me, I think in that particular respect and analogy, I think if we go in a few years back and look back at what we were doing today in terms of X-ray, before that AI transformation came in, we're probably smiling about the way we work today.
Yeah, possibly. Sounds very exciting. Thank you, George. Okay, let's have a look. Let's go back to Jeroen, a more technical question. Jeroen, what's the accuracy of the patient thickness measurements?
So our systems already have 5 different categories which the operator could use before to fine-tune the dose with respect to the specific patients. For body part thickness, he can adapt the dose. And what he had to do up till now is manually pick these categories. And our system is designed in such a way that it measures the body part thickness and automatically suggests the right patient thickness category, body part thickness category, which takes the guessing out and hopefully definitely brings more consistency in the process. And of course, the accuracy is targeted to make sure that we end up in the right category. That's the main target.
Okay, yeah, thanks, Jeroen. Gert, a commercial question: Can the 4 features be purchased separately?
So Liv and SmartXR consists of 4 features, and these make up our AI assistant. And we're not planning on cutting Liv in pieces already.
Okay, she'll be happy with that. Yeah. Good. Not sure who this one is for. Maybe Jeroen. Some competitors have 5 chambers AEC chambers. Can we say that this R is even better for positioning control?
It's an interesting question. At first thought, I would say adding more AECs is not going to solve the problem of knowing where your AC cells are, because the basic problem is you have an AC cell in your bucky and your patient is in front of it, so you can't see it. And what our system does is virtualize or indicate where these AC cells are, whether it be 3 or 5, it's going to be the same problem. So you have to position your patient, for example, with the lungs at exactly the right place in front of the AECs.
Yeah.
And so our solution is not adding more AEC cells, it's making sure that the operator knows where they are so we can better position the patient.
Yeah, okay, good. Somebody is interested in AI for the DR800 for RF. Can we say anything about that?
Well, we very much intend this to be a cross-portfolio AI assistant, and there are challenges for each specific system to overcome. But this is in our roadmap to upgrade our DR line.
Okay. Maybe you can add, I think you mentioned it earlier already, when will the SmartXR technology be available in the US?
So we are fully FDA approved. So that means that it's available from today.
Okay, good. This is an interesting one. Also for Gert, I think. Do radiographers ever feel that the system is like Big Brother, which highlights radiographer mistakes, for example? If the system has to make many corrections, is this going to be negative?
Yeah, that's a good question. And there, whatever our AI assistant provides is between the operator and the AI assistant. So there is nobody listening in. And that's why we see it more as an opportunity to actually train and be aware of problems like AEC positioning, be aware of problems like alignment for the radiographers that might have received less training. So we approach it a bit different than trying to Big Brother people that are already under quite some pressure to perform today.
Yeah. Can I maybe have a comment on that as well? So our systems are intended to assist the operators in preventing mistakes. So we believe, and that's also what our pilot sites told us, that these systems help you to make better exposures, which reduces the number of mistakes. So we're not focusing on making metrics and on KPIs, but really focusing on preventing mistakes in the first place.
Yeah, makes sense. Okay, I think we have one more. It's about the metrics. How are we measuring this increased efficiency? Is it just patient throughput or other things? Can we say anything about that, Gert?
Well, I think if we set up a study to monitor what the impact is, it would indeed focus on the number of retakes, for instance, that we can reduce by having a SmartXR upgrade in there. And of course, patient throughput should then also be should evolve in a positive sense.
Yeah.
If we manage to increase the efficiency there.
Okay, thank you. I think we are through our questions.
I saw a second part to that question. So what about the patient outcomes? So that, of course, we aim to increase consistency there. And that translates to better patient outcomes. I think Dr. DeMay also mentioned that.
The example of the images being consistent on the packs and having a good
both
comparison.
for comparing priors and priors and pathology across different patients.
Mm-hmm.
It's important that we provide that level of consistency there.
Yeah. Okay. Very good. Well, thank you everyone for answering the questions. Gert, Jeroen, and George.
You're welcome.
My conclusion after hearing all that is that SmartXR solution will assist X-ray techs in lowering patient dose, reducing retakes, creating more consistent images in the packs on PACS presentation, and of course, so they'll be able to spend more time and more focus on their patients, right? Pretty much.
Yes, that sums it up great.
Okay. Well, thanks to everyone who contributed today. Mostly, of course, thanks to everyone who is watching this, who tuned in for this session. And of course, this is just the start of your RSNA experience. We hope that you will engage with us further, and we'd love you to come and visit our virtual booth through rsna.org, where you'll find much more information about all of our products. And also, very exciting, there will be an interactive experience where you can engage with Liv to find out how she can help you in the future. The recording of this session will be available on this page and through the agfa.com radiology webpage. And we hope that you will enjoy the rest of your virtual RSNA experience. And of course, most of all, we hope that we'll all be together in Chicago next year, face to face. Until then, stay safe and bye-bye.